In News for Your Health, you may think you've heard it all before when it comes to skin cancer.
But you haven't, because tonight, Dr. Max shares with us a very different and personal take on sun, skin, and cancer. Max?
That's right, Jim and Sue. I've been telling people about the dangers of sun exposure almost as long as I've been a medical reporter. But now the topic has become personal. 2 weeks ago, I was diagnosed with skin cancer. Here's how I got it and what I'm going to do about it. I was born in the tropics, Havana, Cuba to be precise. In a lot of my baby pictures, I was at the beach. When we moved to Miami, still pretty intense sun, I played lots of sports, so I spent even more time outside. And in those days, suntan oil had no sunscreen, no SPF, no sun protection. My nose would sunburn, and then I was a little kid, and I'd pick at the little sunburn in the skin, and it would, peel off and kind of bleed, and by the end of the summer I had this sort of dark patch where I just kind of picked it raw there. In college and grad school, I added canoeing, kayaking, backpacking, more sun exposure. Add it all up, and it's no surprise that...
Now this is the area we did the biopsy on. Now this was a little skin cancer. This is what we call a basal cell carcinoma.
I knew I was at high risk because of my sun exposure, so Dr. Bruce Katz has been checking my skin for years. When actinic or solar keratoses have popped up, pre-cancers, he's frozen them. But even under expert supervision, sometimes something slips through. Over the last maybe 6 months or so, not only did it flake a little bit, but it got just a tiny bit raised or elevated. And when you still finally hear that diagnosis, it took the wind out of my sails a little bit, partly because I also then knew what it implied, what I was going to have to do. It could be from a pencil eraser to
the size of a nickel. Yeah, or the size of a dime.
Basal cell skin cancer is very curable as long as you cut it all out, leaving a fairly significant hole on my nose, which Dr. Thomas Romo will have to figure out how to close.
There are grafts, pieces of skin that come from other areas of the body, and there are flaps.
Even though we can cut it off and, quote, cure the skin cancer, you may lose a good chunk of your nose or of your cheek or your ear. Which is why dermatologists are so adamant about prevention, especially in kids. You get 80% of your lifetime sun damage before age 18. Sunscreen can prevent that. This is the cautionary tale for people, and so I'm hoping that people they'll understand what it's like. 4 out of 5 skin cancers are basal cells, the least likely to metastasize. Next most serious are squamous cells, which can spread if left long enough. And then there's melanoma, lethal because it spreads even when it's very small. And by the way, it's a myth that darker skinned people don't get skin cancer. Even African Americans can get skin cancer, so everyone has to watch out in the sun.
So what happens now, Max?
Tomorrow afternoon, they're doing what's called the Mohs surgery. They'll cut out the skin cancer, look at it under a microscope, make sure they've got it all. Then I go from there to the plastic surgeon's office, to Dr. Romo's office, and that's where he'll do the flaps and the skin grafts.
One right after the other?
One right after the other. I'll be out for about a week, but I'm going to be back next week, probably with a bandage still on my nose, but right in that spot right in there. And we'll see. We'll see how it heals. I'm going to get a new nose.
All right,
variation.
We'll be happy to have you here, bandages and all.
Now, are you going to change your behavior at all?
Well, I did a long time ago. I started wearing hats and baseball caps, big wide-brimmed hats on the golf course, lots of sunscreen. But I've been especially careful about that lately.
Isn't this one of the fastest growing cancers?
It's an epidemic right now. Dermatologists say it's absolutely an epidemic, partly because people are spending so much more time out in the sun than they used to, and also because the ozone layer is thinning, so we're probably getting a lot more UV radiation even in the amount of time that we spend out there. So yeah, it's an epidemic. It's growing.
So what was your reaction when you heard the word cancer?
Well, I knew it. I mean, I knew that I was at risk for it, but it still kind of takes you back a little bit, and you go, all right, now what do I have to do to deal with all of this? But again, if you avoid that sun exposure, especially when you're young, when
under
kids,
21,
under 21, boy, you are just way ahead of the game, because that's where you get most of your sun exposure and sun damage.
And we now know so much more than we did as kids about how dangerous it is.
Absolutely. Nobody knew back then.
Good luck, Dr. Max.
Thank you.
And we'll see you in a week or so.
You bet.
All right.